Hi, everybody. Dr. Debunk back again doing kind of a continuation. I just did a video on vitamin D and vitamin C. But this is a purely educational video because patients are always asking me about nutrients and vitamins and minerals, how to take them. And so this is like the shortest presentation I can give to help you supplement with these things. This video will be iodine and magnesium, because vitamin C, D, iodine, and mag are unique. I think everybody should supplement to some degree with these. Anyway, iodine is probably the most misunderstood mineral in the world, definitely by doctors who don't get it, even nutritionists, because iodine's unique. It's a mineral that's unique to mammals. Only mammals use it. It's actually a poison to all microorganisms, which is a great thing. It's going to be a big thing in the next pandemic, which we'll talk about. But iodine is a mineral that's exclusively used by our thyroid gland to build the thyroid hormone. And there's a long history of use. I think, if I remember, the British in 1890 started to use it, maybe even before, actually. No, that was thyroid, actually. So, but because mammals use it to build thyroid hormone, and the thyroid hormone is what regulates metabolism more than anything. It's the energy hormone. It's essential to have optimal levels of iodine. So essentially, thyroid is iodine. Bottom line is, we build this little protein structure. It's similar to a protein peptide, which I'll be doing a video on that. That's an exciting field that's been around a while, but now is booming. Anyway, so thyroid is unique in that, and so it's just a matter of putting iodine in this protein structure. And hormones are signaling molecules. Hormones are kind of the most powerful molecules in the human body, and so thyroid has the dominant effect on your perception of mental and physical energy. And part of the deficiency that's epidemic in America today, because in modern societies, thyroid hormone is the #1 epidemic deficiency of all hormones, bar none. And part of that deficiency is related to iodine deficiency. So if you supplement, you can make more thyroid naturally. But people generally don't take enough. And you have to study a long time to understand the relationships here. And so anyway, and so basically, taking thyroid is not an option, or taking iodine is not an option, but it's only part of why we're thyroid deficient. So it won't fix you, but generally people, when they take it correctly. And so if you're low in iodine, then you're going to be low in thyroid, you're going to be low in energy. So hypothyroid, low energy symptoms, which I've done a video on that. You should go look at that, and then you'll understand the relationship better with iodine. Taking iodine is essential. And so the mechanism is basically the thyroid hormone basically, am I even going to go down that road? No, there's just too much information here. So I'll just get to, if you're low in thyroid, in iodine, you're going to be low in thyroid. And so you'll be tired, mentally and physically tired. You'll get brain fog in the afternoon. You'll have hair loss. You'll gain weight. You can't exercise. And you can look at the thyroid video to get all the other symptoms. But basically, it's epidemic in America today. The #1 reason Americans are tired is because of low thyroid, and partly to low iodine. And so, why don't we get enough iodine? Well, it's because it's an ocean mineral, and we don't eat ocean plants, so we're not going to. The soil, there's just not iodine in the soil, and land-based plants just don't uptake enough. And ocean plants taste like rubber. I mean, just next time you're at the beach, go chomp on some kelp and you'll see. But that's where the iodine is. So we're not going to do that as Americans. The Japanese do it, some other Eastern cultures. And the Japanese actually have done all the studies really to prove everything I'm saying to you is true. And it's been over 40 years they've been doing this stuff. And the Japanese counterpart to you, whatever your job is, whatever, whoever you are, they're getting anywhere from 6 or 7 to 10 times more iodine a day than we do. And they're much healthier for it. So we're going to supplement. And you can supplement with pills or capsules or tablets or liquid. The liquid's tough to do. So basically capsules or tablets. Anyway, and so how much do you need to supplement with? Well, that's been kind of shown what the optimal levels over the many decades. Like I said, this goes back to the turn of the 20th century. So there's a lot of data out there. But I settled on, after doing hundreds, at least hundreds and hundreds, of blood iodine and urine iodine tests to try to see what people need. I think people should supplement with, 6 to 12 milligrams a week. And they make these 6 and 12 milligram tablets. There's a company called RLC Labs and some other ones. But you can't do the FDA standards because they're stupid. Why they came up with these ultra low standards is a long, twisted story I'm not going to get into. But you'll be way underdosed. If you take what they say, you'll be deficient your whole life. And so, just like with vitamin C and D, pretty much all nutrients, you have to load at first. You have to take a lot. And then you back down once you're no longer deficient. You're down here deficiency, and you want to be up here at sufficiency. And so iodine, if you take a minimum of 6 milligrams a day, and you could do up to 12, you do it for 30 days, and you're not going to be deficient anymore. It should eradicate it. And this is based on a couple hundred studies at least that I've done over the years on patients. See, once you have enough of any nutrient, your body's going to start to get rid of it. Once you have enough iodine in your cells, I'm sorry, not the cells, in the thyroid gland, then it's going to stop uptaking. And it appears that women's breasts are the only other organ that uptake iodine, which would make sense because a baby is going to breastfeed and needs a bunch of iodine to get its life going. And so it would be in the breast milk. And so anyway, so once thyroid gland has enough, then it's going to sit in your blood and you'll just start peeing it out. And so enough studies have been done that we know once you start peeing most of your daily dose of iodine, well, then you're just giving iodine to your toilet. So it doesn't make any sense. And from all that work, not just me, I've really got this from other doctors, figured out that these are the doses. And the problem is the stuff in the health food stores is pretty weak. They have liquid drops, they have tablets, but you can get these little 0.5 milligram, 1 milligram tablets, and you just have to take a lot. So for sure, there's a couple companies that make the 6 milligram or more tablets. And so you just do 30 days of 1 tablet a day with food, and then you do it 1 day a week forever. And I found that you can achieve you can maintain good levels at 6 to 12 milligrams 1 day a week. But first, you have to get undeficient. So even if you started taking a 12 milligram every day and you needed that to be optimal, well, if you start out real low, you have to take extra to go all the way up. If you just take the maintenance amount down here, you won't get lower with age, which is what we're doing for a lot of reasons. You would just stay at whatever deficient level you are. But we want to go up to optimal. And we have, like I said, an idea of optimal. And so I found that's pretty effective. So to summarize that, if you have get your little pen out, you take 6 to 12 milligrams, which is 1 or 2 of these tablets. Like I said, they make it in both doses. You take at least 6 milligrams every day for 30 days. And then you just take 1 or 2 a week. Some people, because I forgot, my thyroid patients that I have on thyroid hormone are always getting a little bit of iodine by supplementing with external thyroid. Normally, if you're not taking thyroid, well, then you're always recycling your iodine as thyroid breaks down. And iodine is definitely the most efficiently recycled mineral in the human body. And I want to explain why that's true. But and so my patients that are on thyroid, 3 or 4 days a week, which is most of them, then on the weekend you take one extra dose of iodine to keep your levels going. But if you're not on thyroid, then you probably should take for sure 12 milligrams 1 day a week forever. And when you do that, the cost of a bottle for like a year supply is like $15, $18. So it's a little more than $1 a month. So it's really nothing. And you will probably see a difference in your overall energy levels. And then there's other benefits, but that's the main thing. And so that's it for iodine. And we'll take a break, and then I'm going to do magnesium.